Hi, hello everyone. I'm Deepa here. Today I'm here with some of the professions which we are commonly using in OET letter writing. I hope this video will be useful for some of you. I have some notes about all the professions, and I may look at this one in between. Please forgive me for that. Firstly, we are going to talk about the SALT assessment. SALT is speech and language therapy. In our hospital, we are referring many patients for SALT assessment due to their communication issue or the swallowing problem. This may be due to many diseases or due to the congenital anomalies. Firstly, the patient is after Parkinson's disease or stroke or due to any neurological impairment, which makes them to communicate badly, or they have some problems with the communication, or sometimes will not communicate to any of the staff in the hospital. In that situation, we are referring these patients to the SALT team. They'll come and assess the patient. They will give them some computer assistive devices, or sometimes they'll give something like materialistic things to make them communicate. So this is in point of communication. Another view is about the swallowing. If the patient has dysphagia due to any neurological impairment or due to any surgeries or due to any kind of disease like dementia or old age, these all things will be referring to the SALT team. If they come, they'll assess the patient and they might prescribe to give the patient semi-soft diet or puree diet. Sometimes they'll tell you to insert an NG tube for the feeding if the patient is not okay with that. These are the job roles of a SALT team. And the next profession I'm going to is podiatrist. Many of my students, when I asked them about the podiatrist, they told the job role is to look at the feet and to check if there is any injuries or any problem to the foot, which is absolutely right. And along with that, I want to add, if there is any fracture to the foot or nerve damage or anything which can cause a foot injury, we can refer them to a podiatrist. A podiatrist will be working in a health clinic or a community-based setup or in the hospital. They are the one looking at all aspects of the foot, including the diabetic foot, any injuries, any nerve damages, or any kind of fracture. So whatever happens in the foot, you can refer the patient to a podiatrist. Their job is to look after your foot. They'll make the patient absolutely beautiful to walk like a normal man. This is their aim of the job. Next, I'm moving to the paramedics. If somebody telling you to write a letter to a paramedic staff, what do you know about the paramedics? They are the one working with ambulance and emergency care. If any patient has any problem outside the hospital, in the community, or in the home, or outside, whatever, paramedic staff is the one taking care of them. They are ACLS providers. They can provide acute illness management, including minimal wound dressing, wound management, injury management, any critical medication, providing DC shock, AED operation. These appropriate treatment they'll provide in the right place. This paramedic staff can be an ambulance driver or a nurse who is working in this team. So if you want to write a letter to them, you should know they are well managing the critical situation with their skill, including the medication, wound management, and the emergency treatment. They can provide CPR to the patient. They can provide a shock to the patient. They can provide the emergency medication to the patient. At the same time, they are brilliant enough to intubate the patient in some conditions. Next one is orthotist and prosthetist. Orthotist and prosthetist is, from the name itself, you know that it is something related to ortho. If the patient lost an arm after amputation or due to any surgeries or anything, due to any disease condition, they might prefer to be replaced with a prosthesis. Orthotist and prosthetist are the one providing equipment to that kind of patients. They will take the measurement of foot or leg, whatever, and they can prepare the similar sized equipment for according to the patient need. So there will be a consultation with them, and there will be an x-ray and camera examination, camera examination. If it's in the foot and they want to wear something like a shoe for the patient, they'll take the measurement of all the side of the foot, from front to back, from side to side, up to down. All the measurement will be taken and will be providing with a new shoes which is appropriate for the patient. And they'll provide some supportive devices also. And sports injury, if somebody got a sport injury, like a knee injury, this type of patients also will be referred to them. They can give some knee brace or some supportive devices to the knee. And they will take a complex measurement of each and every part of the injured area. Then according to that, they are measuring and preparing the device which is needed for the patient. Next, we are talking about the occupational therapist. Occupational therapist, their main job role is to provide a completely safe, independent life to the patient. If we are talking about that, we must know that they are looking at the cognitive aspect of the patient. If somebody got a learning disability or they have any neurological damage due to any problem, and they need to use a specific equipment or they need to engage in a special activity, this occupational therapist will arrange everything for them. You can say in UK, occupational therapy team is working in a community health center setting, and they may be working in a clinic. And there will be some garden which is affiliated with this occupational therapy team service and the NHS service. What they do is, if the patient is mentally disabled and they are thinking a lot about their past and they become aggressive in some times, so occupational therapy will make them to engage in gardening activity, which will make them so cool. Gradually the patient will be okay with that. And some patients, they might be using a wheelchair, electronic wheelchair, for the first time in their life, and they need some support for that. Occupational therapy will explain to them how to use it, and they will make a bed which is convenient for them to slide from the wheelchair to the bed. So the equipment wise, they are working on it. In the cognitive aspect, they are working on it. They might provide some minimal exercises to the patient to make the patient work in a normal environment like a normal human being. Mainly, they are working on dementia patient and mental illness patient, so that they'll be all right with the treatment along with medication and other treatments like other leisure activities. Next is about the music therapy. I know that we were afraid about the music therapy like a month before or two. We got a letter in the OET exam. So everybody was concerned about the music therapy. First time some of them heard about music therapy. Music therapists, they are working same like occupational therapy. They mainly focusing on the cognitive part of the patient. Like if somebody is substance abuse and they don't want to interact with anyone, they don't want to talk to any of the staff in the hospital or in the home, in the society, such cases the music therapist has some influence on them. They can sing song, they can play some equipments, and gradually they'll be involving with that. And about the children, if mother and child bonding is not well developed and mother doesn't want to care about the baby, it can affect the baby very badly. The baby will be like a kind of isolated, and they'll be mentally disturbed, angry and all. In such cases, this music therapist can help the baby as well as the mother. They will give a treatment in the form of music, which is giving relaxation to many people. Some music therapists, they'll play the equipment. Some of them, they will use the music in kind of songs. There will be single therapy and a group therapy. If somebody is interested in music as a group, they'll be all right after a week of consultation. This is what they focus on. Mainly they are focusing on the postnatal depression, substance abuse and problem with attachment to child. Next is about the dietitian. Most of us, we know about the dietitian, what they do, but they are usually working in the hospitals, community health center, in a clinic, or separately they will have a dietitian clinic as well. Mainly they will look at the must score. Malnutrition screening tool is that. Malnutrition universal screening tool, that is must. In that we will check the patient's weight and height and BMI. If the BMI is very low, the dietitian will prescribe some supplements to the patient. In situations like this country, the dietitian will visit the patient at home and they will teach the patient how to prepare the formula. They'll show them how to prepare it and how to take it. And in the hospital setting how they are working. I don't need to go through that in deep. Another one is art therapy. Art therapy is a communication through the art. You can see some of them, they are hesitating to talk to us or in any neurological problems to them. So this art therapy helps them to psychologically involved in the art. They might give some kind of crayons or paper to them in the beginning, and they'll make them to draw 1 or 2 lines in the beginning. Gradually, the patient will be involving in the art therapy and they will be perfect in that. They can release their stress through that. Some patient, they will draw the violent pictures in the beginning. We can see that somebody will draw like a person is killing someone or something like that. But gradually it will come to the peace side of that and they'll be all right. This is the art therapy, what they do. They are focusing on schizophrenia, depression, personality disorders, and some person who are resistant to talk. Next one is orthoptics. Orthoptics you may confuse with the orthopedic, but it's not orthopedic. Orthoptics is completely about eye and vision. So what their job role is to check the vision problem, especially in the children who has squint eye, disordered eye vision, or any problems with eye. They are working on it. They'll provide special assistance to view the pictures with glass and without, or with some frames and so on. What we need to check there is about the alignment of the pupil, about the encouragement to the child to live in a society. That's what they do. Especially they will provide eyeglasses, eye patch, exercises, and sometimes they may refer the patient to the eye surgery team. Especially if the patient has some disability or communication disability neurologically, or due to diabetes or hypertension or Parkinson's disease, the doctors are referring these kind of patient to the orthoptics department. They can handle them easily. Another one is therapeutic radiographer. Don't be confused from the radiographer and therapeutic radiographer, to entirely different job roles they have. Because the radiation therapy is the main job role of the radiotherapist. They are providing radiation therapy to the cancer patient. It's not to do just an X-ray or ECG or scan. It will be similar to the CT scan machine, but the patient will be getting a radiation therapy through this machine. These all are the main job roles of some of the professions. I think this may be useful for if you want to know about any of the professions which I didn't mention in this video. You can just comment below. I'll be coming back with that in detail. I am working currently in UK, so I know some of the job roles which I was unfamiliar before, so I can help you with that. Thank you guys. Bye.